Good afternoon, everybody. Welcome to Parent University. My name is Grace Valenzuela, Portland Public Schools Executive Director for Communications and Community Partnerships. Parent University is a forum to bring together parents and caregivers to learn from experts and each other. For those of you who are new to Portland Public Schools, this is Parent University's third year of exploring issues and topics that are important to families and or are challenging to talk about. We've typically done our sessions in person. With this new format via Zoom webinar, we will do our best to make it as fun, interactive, and informative as we did them in person. This session will be interpreted in different major languages spoken by families in Portland schools. We remind our families to speak slowly. Maureen Clancy, Language Access Coordinator, will explain to our audience how to join in the different language rooms. So Maureen, and if you could move the slides. We need a closed caption too.
Hello, everyone. Good evening. If you need an interpreter tonight and you're joining us on a computer, you will look for this symbol on the bottom of your screen, circled here in red. It looks like a globe inside a box. You'll click on that and you'll see a list of languages pop up. You'll pick your language and then mute original audio. Next slide, please. If you're joining us by phone, you'll find a little black box with 3 dots, the More button circled here in red. You'll pick that one, select More and Language Interpretation. You'll see a list of languages. Pick yours and then click Done or Save. Next slide, please. So tonight we have interpreters in Spanish, French, and Portuguese. For those languages, select Spanish, French, or Portuguese. Zoom only has certain languages. So for our Vietnamese speakers, you select Chinese, but you will hear Vietnamese. Sorry. For Arabic, select German, but you will hear Arabic. And for Somali, select Korean, and you will hear Somali. For Spanish, we have Betsy with us tonight. For French, Josephine. For Portuguese, Karina. For Vietnamese, Thuy. For Arabic, Ahmed. And for Somali, Shamso. We also have 2 ASL interpreters who are also with us tonight. Thank you.
So Nanette, I'm not seeing the spotlight for the ASL interpreters. So we again remind our panelists and speaker to speak slowly to help our interpreters. We will be using a variation of the fishbowl for our presentation tonight, so fishbowl format. Dr. Douge will do a slide presentation, and our panelists will respond to the presentation with questions and or comments. For those of you in the audience, you can join the discussion by using the Q&A tab at the bottom of your screen to type in your questions or comments, and we will bring those up to the floor. And with that, I'd like to introduce our speaker and our panelists. Dr. Douge is a pediatrician, speaker, and writer. She holds a Bachelor's of Science in Pharmacy from Rutgers University, a master's degree in public health for Johns Hopkins Bloomberg School of Public Health, and a medical degree from Rutgers Robert Wood Johnson Medical School. Dr. Douge's experience includes general pediatric practice, public health, school-based health centers, project management, policy development, program development and evaluation, health promotion, health disparities, adolescent health, school health, cultural competency, and community engagement.
Rainy, windy night, so you probably should bring the letter back in and we should put it out there tomorrow morning.
Somebody's microphone.
Okay.
She is a co-author of the American Academy of Pediatrics Policy Statement on the Impact of Racism on Child and Adolescent Health. In addition, she's the author of the upcoming middle grade novel, Learning to Love All of Me, and is the creator of What is Black? Blog and podcast. Joining her are our fishbowl panelists in alphabetical order: Dawn Gersh, Assistant Principal at Ocean Avenue Elementary School; Jess Hathaway, a parent and a member of the Family Partnership Advisory Committee of Portland Schools; Rohan Henry, who is an EL teacher and a parent in Portland; Christine Andaya Biyoga, who is a parent and member also of the Family Partnership Advisory Committee; Christopher Reiger, Director of Social Emotional Learning; Roberto Rodriguez, who is also a parent and a chair of the Portland Public Schools Board of Education; and Barrett Wilkinson, Director of Equity in Portland Public Schools. And with that, I'll turn it over to Dr. Douge.
Thank you very much, Grace. It's a pleasure to be here this evening, and thank you for that wonderful introduction. So I will get started. So as you all are aware, we're going to talk about the impact of racism on the health of children. I'm technologically challenged, so I'm trying to forward the slide. All right. So as Grace stated in the introduction, I'm the co-author of the American Academy of Pediatrics Policy Statement on the Impact of Racism on Child and Adolescent Health. This policy statement took about 2 years to really be complete, and it came out last year. So this past summer, we celebrated the first year anniversary of this policy statement. And what's so great about this policy statement is that we took my co-authors, the lead authors, Dr. Maria Trent and Dr. Daniel Dooley, and we combed through a lot of research to write this policy statement so that we could provide information about the link of racism to health outcomes, and also providing recommendations for pediatricians and other child health care providers to really find ways to mitigate the impacts of racism on children's health. And as we go through the presentation, I will talk about those health impacts as well as opportunities for how we can help parents and how parents can help children address racism. So I wanted to start off with a definition from Dr. Kamara Jones, who has done a lot of work both as a physician, but as well as a public health doctor addressing racism. So she defines racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. As you can see, I have highlighted the things that really differentiate racism. So racism unfairly provides advantages others based on skin color and disadvantages others based on skin color. And I want to talk a little bit about this idea of race that we use to classify people. There really is no biological basis for race. Race is a social construct, but it is used by us, right, to create social classifications based on how someone looks. And based on these social stratifications, based on how someone looks or appears to look, based on these categories, is then used to assign power, privilege, and advantages.
Dr. Douge,
Yes,
could I ask you to slow down just a little bit? The interpreters have asked for just a little less speed.
certainly.
Thank you.
So when we talk about race and racism and put it in a context of a health concern, I'd like to use this quote from Dr. Maria Trent, who was also one of the lead authors for the policy statement. She states that racism is a socially transmitted disease. It's taught and it's passed down. So as a pediatrician, and those of you who are educators, this is an opportunity for us to really understand that we have a stake in how do we help prevent poor outcomes, poor health outcomes for our children by addressing racism. So the impacts of racism on children's health go across physical as well as social, emotional, and general health. Research has shown their poor health outcomes. As we've noted, the COVID-19 health disparities in terms of both death as well as illnesses disproportionately being burdened by communities of color, specifically Indigenous, Latinx, as well as African Americans. Also, our infant mortality disparities. So African American infants tend to have twice the rate of death versus white babies. And also maternal health disparities, maternal deaths. There are disparities for Indigenous women as well as African American women compared to white women. Also, there are poor general health. Individuals who state that they've experienced racism or discrimination tend to indicate they have poor health than those that have not experienced racism or discrimination. And then also, there's also an academic impact as well. Individuals who have experienced racism have in some instances had poor academic outcomes. And finally, poor mental health outcomes. Examples of depression and anxiety that are experienced by youth who have either witnessed or experienced racism directly. I wanted to highlight this slide because we tend to think of racism, those that have direct experiences from racism having the most health consequences or mental health, behavioral health consequences. But what we also find is that individuals that witness racism also have, as we like to call bystanders. They also suffer as well poor health, physical as well as mental health outcomes by even witnessing racism. So I underscore this because all children, given the current the last couple of months, right, this summer, these two pandemics of COVID-19 and racism have experienced a lot of witnessed a lot of trauma and are experiencing, many children are experiencing the results, physical and psychological consequences of seeing the events of racism.
Dr. Douge, we're going to take a minute to change our interpreters for the ASL, and it gives us a break to let our interpreters get a drink of water. And thank you. 1 second. I'm not seeing you, Margaret. There you are. I've got you now. Okay. Sorry. Thank you. I'm just going to put the spotlight on. Okay. Let's see. Not seeing that. Lost her. Margaret, are you still there? It's hard because I don't see her.
Right here.
Yep.
Can you see me?
I can't. I'm seeing Dr. Douge.
Okay.
Okay, I see you now. I'm just not seeing the spotlight, that's all. Okay. We can continue and I will keep working. Let's see.
Okay.
Okay. Okay.
So good to go?
I think so. I did just lose her again. I think keep going and I'll keep trying here. There we go. Okay, I think I can do it this way. Okay, got it. All right, here you are. Okay, you can continue. Thank you, everybody. Sorry about that.
So I wanted to talk a little bit about how children learn about racial bias and racism. So as early as 6 months of age, babies can notice race-based differences. They don't ascribe bias to those differences. It's just a developmental process. They're able to discern their parent from someone else. They can see different colors. So that's just normal development. By 2 to 4, children can start to internalize racial bias. By 5, children of color are conscious of existing stereotypes of their group. And then by age 12, they can start to develop this notion of racial bias. But this time from birth to 12, though, it gives parents a great opportunity, almost a whole decade, to really help children learn about accepting one another, cultural differences, and improving cultural understanding. So I wanted to share some strategies to help our children deal with racial bias. So three key points. It's important that we talk to our children and acknowledge that racial differences and bias do exist, and that to talk about race is not racist. It's important to acknowledge that there are differences. We teach our kids they're different genders, they're different hair colors, they're different eye colors. So it's important to acknowledge that there are differences. Also, we want to, as adults, confront our own biases. We need to find out for ourselves, do we hold beliefs that are different than how we act or how we want to act, and how do we want to model for our children how we want them to treat others fairly and kindly. And then lastly, we want to encourage our children to challenge racial stereotypes and racial bias. And this can be done by showing the importance of being kind and compassionate when interacting with people from other racial, ethnic, and cultural groups. So I talked about the importance of parents confronting their own biases. And how do we do this? So here's some suggestions for how to do that. So we want to be a role model. So we want to identify and correct our own racial biases, thoughts and actions. And if we want our children to believe what we preach, then we need to be engaged in the behavior that we want them to have. And we also want to think about what everyday comments and actions are we hearing or that we're using that might be contributing to examples of racial bias or racial intolerance. Another suggestion is looking at your social network. Do all your friends and family look the same, or do you have friends and family, colleagues that look different than you are? So we want to encourage children to have diverse circles of friends. And again, this also lends to the engagement in multicultural activities and experiences. We want to, when we can travel, okay, I know this is COVID-19, but we can travel virtually so that we can expose our children to other communities. So this could be done through museums, through books, through going to the library, maybe even thinking about if you are ordering out food, you know, maybe trying a different restaurant, different foods that are outside of your cultural, the foods that you eat culturally. And then also I definitely encourage parents as well as children to model for them to get involved in your school, your place of worship, and in politics. Parents who are involved in this way are better able to advocate for fair treatment of racially marginalized groups and raise awareness of race issues in other groups. And how can we talk about racial differences and racism? Again, I want to underscore that talking about race is not racist. It's okay and it's important. So some examples for the different age groups. For preschoolers, if they notice a difference, they might say that, oh, that little girl or that little boy has different hair color, or this woman might have a different skin tone. So, you know, sometimes as parents, our first instinct is to just kind of like, you know, you're embarrassed, you get embarrassed, and you just want to tell your child that's not right. But I would encourage you to acknowledge the fact that your child has brought up a difference, but I think it's how you engage in the conversation about the acknowledgement. You can talk about how wonderful it is that we're all different, and also share the commonalities that we have. For grade schoolers, the discussion about race and racism and racial differences might be a little bit easier to have and for you to have more open conversations. But if you've laid the groundwork from when they're very young, knowing that they can come and talk with you, all right, about these difficult topics, it makes it easier, I think, to have those conversations. But it's not too late if you haven't started when your kids were preschoolers. It's always an important time whenever you're ready and your child is ready to have these conversations. And ways that you can have these conversations with grade schoolers include, you can use media, movies, documentaries, even books. And then for tweens and teens, this is an age where you can definitely have more complex conversations, listening to your children and asking them how they're feeling and how they're thinking about these topics. And also it's a great way to encourage activism. So activism, you know, doesn't solely mean going to a protest or attending a protest. Activism could be engaging in the right to vote, writing letters to congressmen, Board of Education, standing up for friends. I share this slide to just show that the issue of racism, discrimination is everywhere. So even though we may be trying to protect our kids from these discussions, or we want to wait till later, in many instances, our kids are hearing and seeing things without us even knowing. Our kids have cell phones, they're on social media, they're watching YouTube, they're tweeting, they're on Instagram, they're on Snapchat. And then recently, this past summer, CNN had a town hall to talk about racism, how to talk to racism for kids and parents. We also have young families and adults who are bringing their children to protest so that and talking to their children about why they're protesting racial injustice, Black Lives Matter, you know, and having these conversations. So we really can't escape this. And it's important that we, as parents being children's first teachers, that we have the opportunity to share with our children our values and why it's important for us to stand against racism and racial injustice. So with all the media exposure that our children may have, some ways to help our children understand what's going on in the news today and in the world is to check in with our children. As parents, I know for me, I do this a lot. I just go in, right, and just tell my kids, oh, this, and that. And what I've learned as a parent is to step back and really ask questions before, and letting my children's answers guide the discussion. We also want to watch for changes in our child's behavior, because much of I say this is traumatic, to watch videos of people being hurt by the police, or watching just racism in general, can cause stress. It can cause anxiety, it can cause depression, it can cause stress. So we want to make sure that we're checking in with our children to see if they're having how they're handling the information that they're taking in. I'd also recommend that we limit what our children see in the media. So if you tend to have the TV on in the background, you may want to be more conscious, or even the radio in the car, conscious about our children watching and listening, and maybe limiting when we're watching the news until our children go to bed, or trying to find ways that we're not always watching television or listening to the radio, spending time together. If it's lovely outside, go for a walk and really engage in family time to sort of decompress and get away from the noise and the news. And as a parent, we also want to be aware of our own emotions. We don't have to be super parents, super moms, super dads, but we need to find if we're emotionally impacted, if we're feeling stressed, if we're feeling depressed or anxious, make sure that you have a friend to talk with. If you find that you need additional support, reaching out to a counselor, talking with your primary care doctor, your insurance company, to find out a mental health provider that you can talk to, because this also affects adults. And again, we want to model the behavior for our kids, that mental health and addressing mental health is important. It's part of our being healthy, and we want to destigmatize mental health. What's going on in the news, as hard as it is, it's also a teachable moment for many families, specifically families of color, Black families. I know myself, having 2 Black sons, I've had the talk, right, where I try to prepare them for potential police interactions, potentially how the world is going to may see and treat them. So I'll have those conversations. But I think white families and other families of color, it's also important to have these conversations as well, so that, one, they understand what their friends might be going through and can be supportive for their friends. Also, two, many families in the past, I know the recent news, we talk a lot about Black Lives Matter, but many communities have experienced racism. Unfortunately, even more so through COVID-19. We've had anti-Asian racism, Latinx racism, indigenous. So many communities are experiencing racism and the trauma of racism. So it's important that we talk to our kids, prepare them for what's happening, and also really find ways so that they know that if they have concerns or questions, that they can talk to you or a trusted adult. And then resources can also help. If you're having difficulty having these conversations, I'd say it's important to talk to your pediatrician, talk with your teachers, also talk with a friend, because sometimes if you're not able to have the conversation, there may be another family member or friend that you trust that can help you have those conversations with your children. And I love books, so I think books are wonderful resources to really sort of bridge conversations, and also provide our children resources for how to learn about differences and how to appreciate differences. So these are some examples of wonderful books that for different age ranges. from little kids to adolescents. And I'm also sharing some additional resources that help provide a little bit more information about how to talk about these conversations, additional book recommendations, and videos and documentaries for you to use as resources as well. And in summary, racism does harm health. Children directly experiencing and bystanders to racism are equally affected. Children learn about racial differences and racial bias from an early age. Children are listening and watching what is happening in our nation today. And what's happening now is a teachable moment. As parents, we're our children's first teachers and have the opportunity to help them cope and deal with the impact of racism and react to racial differences and biases. Books are a wonderful tool to have these difficult conversations. And again, I just want to remind everyone, talking about race and racism isn't racist. It's really important and a great way to sort of help our kids, be a buffer to our kids in terms of the health impacts that racism has on children. And I look forward to the panel discussion.
Thank you very much, Dr. Douge. And we are going to now transition to our fishbowl format for the panelists. And again, we can't find people. Our panelists are Roberto Rodriguez, Barrett Wilkinson, Chris Reiger, Don Gersh, Rohan Henry, and Jess Hathaway. Did I miss anybody? So those are our panelists today. Okay. So questions, the audience at home, you can join the discussion and by putting in your question and comments on the Q&A. So we can include that when we are doing our conversation here. So at the bottom of your screen is a tab and Q&A, and that's where you can type your question or comment. Okay, anybody want to start? Panel members.
I'll start. I just want to say thank you so much. That was great. I try to engage with my kids using books as a tool, and I'm wondering if you have any recommendations for different age groups of books that we can read with our kids.
Okay, thank you for that question. For younger kids, for preschoolers, some really good board books are Woke Baby and Anti-Racist Baby. I think for older elementary age students, I would say they don't necessarily have to be books about racism or anti-racism. I would say you want to find books that have authors that have kids of color as the main characters in those stories. You also want to look for books that don't provide stereotypes of kids of color, because again, that just reinforces the issue of the stereotypes in racism. And again, we also want to find books that have kids where they're just doing normal activities. For example, The Snowy Day is a great book about a main character who's African American, but it's not that's not the whole purpose of the book. It's about a child who happens to be African American that's just enjoying a day in the snow, right? And I think ultimately the books for younger kids, I would say, kind of do like a diversity audit of your bookshelves. Do all the books look like your kids? Okay, are they all animals? All right, so I mean, kids really need to see kids other than themselves, whether it's racial or ethnicity, abilities, so that they know that it's normal. Kids come in all shapes and sizes and abilities. So I think that's important. And as kids get older, for adolescents, there's a book Stamped. I think it's called Stamped by Jason Reynolds and Ibram Kendi. And there are also some other book anthologies that are really wonderful books. Black Enough for African American, and not even just solely Black families, but again, I know sometimes there are experiences that Black families have in terms of older kids, depending if they're going to a predominantly white school versus a predominantly minority school, and their different experiences. So that's an opportunity for them to see the different experiences, lived experiences. And then I'd also recommend reaching out to your library and your school to find out some other resources for books.
Rohan, as an author, do you have other suggestions? Do you want to promote your books at this moment in time too? You have to unmute yourself, Rohan.
I should have gotten that now. This is I think I can't remember how many meetings today, so I should know to unmute. But I will say that my daughter and I, this is really pertinent to this discussion, wrote a book which is being shopped. It's already been picked up by one publisher, but we are not sure that we're going to go with that publisher. The book is, like you were saying, Doctor, it's not directly about racism. It's called the Be Yourself Club. And I just happen to have just a rough draft of it. There's a better draft, but this is just I don't know if you could see this. Can you, Grace?
Yes.
Yeah. And my daughter was the one who thought of the book, and I just helped her write it because I've been published by some major publishers in the past. And so I helped her put her ideas and to work. And what the Be Yourself Club is a book where the characters in the book are Hispanic, Latinx, Native American, Black. You see everybody in the book. But the twist that my daughter thought of was that most clubs, you have people that have the same idea and they have the same mindset, whether it's for yachting or whatever club it is. And she said, Dad, what if there was a club called the Be Yourself Club, where the only criteria for admission was that you be your authentic self? And I said, wow. And we sat down, we started writing that book. And it's such a cool book because it's not directly saying, there's a race problem or there's a problem, with representation. But what it's doing is that it shows representation, and all the kids there are appreciative of their differences, whether, some kids are queer or whatever it is. They love each other for their differences, and that's why they're united in this club. And I do believe that you will be seeing it on a shelf in the near future, as we are approaching publishers and things like that. But I do, again, I agree that you don't necessarily have to have a book that is didactic and that is saying, we have to stamp out racism, but you do have to show kids that there's a book that presents them so that they can see themselves reflected in the pages of the book. And lastly, there's so many pages that I think are baby miracles. But one of the pages that we thought of was we had a bookstore, and the bookstore is called the Woke Bookshop. And there's a Native American character who is going into the store. And the reason why it's a Native American character is because she has NTVS on her shirt. And NTVS is an actual indigenous owned clothing company. And that's how you can tell that the girl is Native American because she's wearing authentic clothes. It's a sweatshirt, and Native American populations know about it. I know about it because I interviewed Bridget Neptune and some other people who made me hip to this. And I said, wow, I think I might use this in the book. And so the book is a construct of interviews that my daughter and I went on through various communities to say, how do you want to be represented? And they told us how they want to be represented. And my daughter and I put them as how they wanted to be represented on the pages of the book.
So I just wanted to follow up with what Rohan was saying, because it is important that kids have books that they see themselves in, as well as they see others. But for those who want the importance of having books that represent your child's identity, why that's so important is that one, this concept of racial socialization. If kids learn that they're beautiful and wonderful, right, and it's affirming for them, that actually helps with their self-esteem, and that also is a buffer against racism. So it's actually an important tool. So any kind of identity, right? If you can reinforce and have your child feel and love themselves and feel proud of who they are individually through the books that they're reading, and they're very important first tools to do that. That's important. That's something. It's like a immunization, right? You're gonna give your kids vaccinated, right, to prevent disease. These things that we're doing with books and normalizing everyday people, right? However somebody identifies, right? Race and ethnicity happens to be an important way that they identify, but they might identify, their sexual orientation differently, their different abilities, right? Kids need to see themselves in all shapes and sizes so that they can learn that they're normal, they're beautiful, and that we affirm them.
One of the attendees has commented that the Beautiful Blackbird Festival is still available online, and with the work of Daniel Minter, these are local people, artists, and Ashley Bryan, and with books and activities, so you can check that out. Beautiful Blackbird Festival.
And I'll also plug my book as well, because I've had questions from other parents who are raising biracial children or kids that are ambiguous, because I know I identify as an African American, like everyone has multiple identities. I identify as an African American woman, but I'm also biracial. And so my book, Learning to Love All of Me, for parents who have biracial children or children that identify as sort of ambiguous, right? I think is also a helpful tool, that's important as well. Children who have multiple identities, multicultural, multi-ethnic identities, it's also important to celebrate each of those identities that children have. And there are many multicultural families, mixed race families, so it's important to acknowledge that as well.
We're just going to take a second to switch our ASL interpreters. Hold on. Thank you.
So for the audience, keep your questions and comments coming to include in the discussion.
Thank you.
And okay. So any other questions or comments from the panelists?
Yes, hi, this is Dawn Gersh. Thank you, Dr. Douge. You gave me a lot to think about. And I'm at an elementary school, and when you talked about the importance of those first 10 years, it's a big responsibility for elementary schools and a big opportunity. I think it made me think that children, like our schools are one of the first institutions they interact with without their parents for most of the time, and how important it is for us to be aware of our own biases and to model and to facilitate the conversations. And something that we struggle with is you talked about creating the trust, like parents creating the environment that students will feel safe. And we work really hard to do that. It is interesting that in our current situation, it's even a little bit more difficult. Children are masked, we are separated, we are not sitting in a circle. but just anything, any action or how to establish that trust as quickly as possible. I think sometimes we want it to happen so quickly because we want to dig in, and we're challenged by that. So just the importance of that environment and trust, and how to build that in the school.
So that's an important question. Thank you for that question. And I also liken it to, the world I'm in, pediatrics, right? Because we have families and children. And I think for a long time, the field of medicine hasn't really confronted the structural racism that even exists within medicine. I think we're starting to, but it's going to take time to chip away at that. But I think first and foremost, I think in any relationship that you want to establish trust, you've got to show yourself to be trustworthy, right? And what kind of empathy, are we showing empathy to our families and children? And also looking at our history, right? I think there's also, for example, the American Academy of Pediatrics put out a Truth and Reconciliation statement, right? So they acknowledge the history of racism that itself as an institution contributed to, and working to dismantle that. And it's going to take time. But I think also each institution has to acknowledge its history, contributing to structural racism, and really look at what are the steps and policies that are being done, the trainings that are provided to staff and offered to staff to start to, and even create safe spaces in those institutions so that staff can actually have those conversations. Because if it's not safe for you to have the conversations with colleagues and it's not supported, how is it that you're going to have those safe conversations with families? So I think there's a lot of different things that need to be done to be able to establish that trust. But I think first and foremost, treating each other as human beings, right? And engaging and learning about that individual, not just because they are Black or Latinx or Native American, right? It's really, engaging with them individually, knowing that they have that identity, and being empathetic and asking them, what things do you enjoy doing, right? What do you like most? Who's your friend, right? You want to establish those, getting to know them, right? Before there's a trust. Trust takes time. It's building a relationship, but it's scaffolding, right? It's like, what are we building in order to get to that area, that point where families can trust us? And what work are we doing individually, right? Because this is a process. You don't just read a book and you become anti-racist. You don't have one conversation or have this webinar become anti-racist. Our society has created a system, right? It's created systemic racism for a purpose. And it continues to exist because it serves a purpose. Once it no longer has a purpose that it's feeding, then it'll get dismantled. But we each have to do the work and look at our institutions and our leadership so that we can work to make those changes so that families can learn to trust us and trust our institutions.
May I interject and add on to what you're saying? So I had a conversation with a colleague, and we were talking about books. This is a high school colleague, and that's all I'll say about the colleague in terms of their position. And it's a colleague that I respect in terms of that colleague's ability to teach. And it was interesting to me to see, this colleague is a white person, and it was interesting to see their blind spot, because we were talking about the canon and the books that are there. And during the conversation, she was saying that, it's so important to teach these books, Catcher on the Rye, and she had all the canon, the Red Pony, Grapes of Wrath, and she just, she was listening to all of them. And I said, well, I do agree it's important to teach them, but I said, if I were a Black young woman, gay, and I was in your room, what on that shelf would kind of motivate me to want to learn? and she didn't have an answer. And I just think it's interesting. I'm not, I'm not bringing this up to disparage. I'm just saying that I don't know where we are right now is where teachers don't understand that the absence of female authors or indigenous authors is itself damaging. Like, I don't know that some of our educators understand that. And so I'd like you to comment on that, where we're trying to, talk about books that are important and creating an environment for people of color to succeed in, where the teachers and maybe in some cases the administrators aren't even aware that there's a lot of work to be done.
Oh, and I agree, right? Because representation matters, right? I mean, because you can check off boxes and say you have X amount of people that fit this category, right? And say that you're inclusive, but you can't just have one person and say that you're diverse and inclusive, right? So representation matters. So I think I'll just go back, right? For the longest time, people use colorblindness, right? To say that, oh, if I don't talk about color, then I'm not racist. But it's the opposite. Each individual wants to be seen and heard. And if you don't see color, what are you saying? You don't see that person. So if I show up and you're like, oh, so that's Jackie. You don't ask me my pronouns. You don't ask me how I identify or care to know how I identify, then I don't matter to you. That's your privilege. You have a privilege to erase me and make yourself feel comfortable, when we really have to talk about and really engage in these hard conversations. And I agree with you, if you don't have the books, right, this canon, and who sets the canon? Who decides that this is great literature, right? And it's only white male authors or white female authors, right? We've got to challenge our ideas about what's normal. Whiteness in this country is normalized. When I talk about health disparities, everything is against whiteness, right? So, and to me, even public health wise, to even think about how we frame health disparities, which are really health inequities because of structural racism, is a problem. And I think, and even our educational systems, right? We have to look at our data. Even in medicine, we're calling ourselves to look at our data. We're stratifying individuals by race, socioeconomic status, but then you have to look at that. If there are disparities, if there are differences, why are they differences? And it's usually not solely because of the way someone looks or how they identify. There are other structures in place that make it unfair and disadvantage those children and individuals. And as a system, we have to address those things in the ways that we can and make a difference, right? So that call to activism, right? Parents I encourage parents to ask for the change that they want, but at the same time, I also understand that the systems that we create sometimes make it difficult for parents to ask for the things they need. We have PTA meetings that are at a time when a family member is working late and there's only one car in the household, only one driver in the household, or there's no childcare provided. So we have to look at how can we make it easier, not harder, for our families to learn to engage in our systems and how we are working to, in our systems, make a difference.
Barrett has a hand up.
So not unrelated to that, I really appreciate how you brought up the importance of role modeling with kids, and from a public health perspective, how important role modeling is broadly. And so I wonder, as you were talking, I was thinking about the role that parents play role modeling with each other about how to do this, and wondered if you had some thoughts, because I feel like parents are, they're on PTAs or in the parent organizations, or just like hanging out on the playground, after school, and different kind of conversations come up. And, even though I have a 7-year-old, I feel like I'm still really new at how to role model in my parent role. And so I don't know, I just wondered if you had thoughts about that, because lots of other parents out there might be interested in that as well.
So again, thank you for that question, Vered. I think it's important, right? If you don't know, ask questions, right? So it's about, but you also have to find out what are the resources to be able to ask the questions or act differently. And I would say, I mean, I think there are books out there. There's a book by Margaret Hagerman called White Kids. There's another book, I think I have it on my bookshelf someplace. I forget the name of the book, but there are resources, like anti-racism books, right? And they provide some examples. So I think reading books, books are important. Watching videos, there's White Fragility, right? So there are books, but again, you can't just read a book and just think, okay, everything's great. I would say you may even want to engage in trainings for parents, right? Because I know I have colleagues in the medical field, they do simulation trainings, right? So they role play to educate residents on how to address cultural differences. So that might be an opportunity, right? So if you could have a workshop for families on how to have those conversations and have opportunities for them to to do a simulation. But other than that, it's going to be trial and error. I think it's important that we acknowledge that what we don't know and do something about it so that we can become better parents. And I think even the trial and error is important to show our kids, right? Because you're gonna say the wrong thing, you're gonna do the wrong thing, but you acknowledge and be humble and knowing that I did not know and I'm going to do better once, you know what I'm saying? So it's a process, it's a trial and error, but you can read books, maybe do simulations, but also just do the work. I think that's important.
Thank you. I think that that's really awesome perspective and thinking on it is just that get grounded, but also like do something about it, and that it's okay to make mistakes. You can acknowledge that and how important that is for kids to witness. Love that thinking.
And I think also too, I think that's even why it's more important to have like who are our friends, like what's our social network, right? Because our social network, I'd say, if you have a good friend, different race, ethnicity, if you ask them, humbly, right, and you still might make a mistake, they can be helpful as well. I mean, no one's a monolith, right? Just because you have a Black friend or Latinx friend, they can't tell you the whole experience of being Black and Latinx, but they could be a resource, or even another white parent, or they may have experiences, lived experiences that they can share with you as well.
Roberto, you have.
Yeah, Grace, it's funny, I was inching to prepare my question, so being called on prompts me to do it quickly. Along with what you were just saying, Doctor, there's for many of us who moved into Maine from what we consider to be much more diverse locations, and we find ourselves in a predominantly white space, we purposely, when we have young children, we try to, have play days and have them interact with as diverse a group as possible. And when they're younger, we tend to have a little bit more say in it or control over that. But as they get older, they select their groups. So I was wondering if you had any thoughts about how homogeneous these groups tend to be in spaces like, for example, even within Portland, where we have a diverse school district, but socially we see segregated groups. How can a parent have a conversation with their child? Because I think it would be incredibly troubling if I were to tell my child that I'm questioning who her friends are without there being an incident. Number one, I would never do that to my child just because it literally, it just doesn't seem like a productive conversation. But I would want to encourage us to live what we say has value in being in such a diverse environment, right? So if we praise ourselves for being the largest and most diverse school district, but yet live very homogeneous social realities, are we living, or are we truly getting the value out of being in this environment? So how do we have that conversation with our children who might be preteens or teenagers about their social networks?
Thank you, Roberto.
Doctor, could you just pause for one moment? I'm going to switch with my colleague. Thank you.
Also, the interpreters are getting a little bit tired. So just if we can just slow it down just a little bit for their benefit. Thank you.
And while we're transitioning, there's just a comment from the attendee who said, "That is such a perfect question. Thank you, Roberto." Are we ready?
Yes.
Okay, Dr. Douge, we're ready.
Okay, thank you. So, Roberto, I would actually suggest that we do ask our kids why they are sitting, maybe not, I would actually ask them, do they notice that everyone is sitting together, right? It's the same group sitting together, and why that is, why are they just sitting with, this group of friends? Because one, I think it's the elephant in the room. And so again, it's acknowledging that you've noticed something. I mean, you can even bring it up like, I went to this conference this evening and we talked about this, and I was just wondering, what are your thoughts? Like, what do you think about, do all the Black kids sit together? Do all the Latinx kids sit together? Do all the white kids sit together? And why is that done? Right? Because again, our kids may have a different understanding than we think they do. So we need to ask questions. So I would say, let's ask the question. And then based on the response, you can sort of tailor and have a discussion. But sometimes you might need a little bit of a jump off to be able to do that. So, or a segue to do it. So you can even use this, and I'll do this sometimes with my kids. It may or may not work depending on your child. But I might say, well, today at work, I asked a teenager this question and this was their response. How do you feel about that? So I would say, ask the question. I think it's important to know. But also developmentally, I think it's also appropriate that kids tend to have social networks that reflect their interests, who they look like. So some of it I think is developmentally normal. Some of it is constructed based on comfort level. But I would ask the question and see what kind of response you get from your daughter, or from those who are listening from their children.
Yeah, that's and your answer is in line with everything that we've said so far, right? That we need to normalize these conversations. I have had these conversations with my daughter, and the first thing that I recognize is how aware she already is. How much this is something, like you said, that she can verbalize and explain, why her social networks are what they are. And when there are those again, homogeneous or when there's these segregated spaces, she recognizes them. So I would double down on what you said, and I encourage parents to ask those questions and just normalize that when you walk into a room, that you acknowledge those things if they're there. If you see segregated spaces and you question, I wonder why that is, and is that productive or is that counterproductive? Is this positive or negative? So you're right. I think asking those questions, and I've experienced it, is absolutely the most effective and productive way to deal with it. Thank you so much.
Josephine says that there is a French-speaking parent who raised his hand for a question. So I'm going to bring her out to tell us the question.
Okay.
Okay, Josephine. Oh, are you muted? Let's see. Hold on.
Do you hear me?
Yes, can hear you now.
Yeah, the parent hasn't asked the question, but I see his hand raised. I don't know if we can give him an opportunity to ask the question.
Yes.
I can see, I need to go back to French and then
Okay, I will put you
ask
back
the
in.
question. Yes.
Okay.
So do you want to talk to him, Josephine? Is Josephine talking?
She's talking to him now. Yeah. No? Yeah. Wait. Okay, I'm going to pull her out again. Okay.
He speaks both Portuguese and French. Maybe Corina can check with him.
Oh, okay. Let me put you back in. Okay.
Yeah.
I can't be right now, Ben. Okay, so Karina, let me pull her out. Karina, can you? Okay, we can hear you now.
I don't see him in my group, so perhaps he's in the French group.
Oh, is it this Joseph Iacchini? Is that the person with the hand up?
So could you give the microphone to, could you put him out and have him say what he wanted to say to all of us and then just speak to?
Yeah, that would work.
Okay, so what should I do? Leave her open?
Yeah, I will leave her open and then give Joseph the, unmute him. Is that possible? Yeah.
I can promote him to panelist.
Yeah.
Do that? Okay.
Seems like he's writing French.
Oh, yes, I see a question in French. Okay, I'm going to put you back in, Karina, and let Josephine take that. Is that fine?
Okay.
Okay.
So do you see his question in the chat, Josephine?
Hold on, I'm going to have to put, okay. I'm going to take her out. Hold on. Okay, Josephine, you're out.
Okay.
Do you see the question?
Actually, he left.
Oh, the question is there.
In the chat.
In the chat.
It's me who asked him.
Oh,
if he
you
has a
asked.
question.
Yeah.
Oh, I see. Okay.
So he's no longer there.
I don't see him.
I know his hand was up for a while. Okay.
Yeah.
Okay, I'm sorry.
He left.
I'll put you on. I'm sorry. Okay.
Okay. So Chris, do you have Dr. Reiger? Do you have any question?
Do I have, I'm sorry, Grace.
Do you have any question? Yeah. Or comment? Special thought?
I think, you know, Dr. Duche, like we're in it and we are just trying to like understand how to be in it and have these difficult conversations. And I think that if you have any advice on how we can help our educators have difficult conversations about this work, because I think we're trying to do it, but I know, and Barrett can speak to this as well, and every other educator on the panel, we meet with resistance. about having honest conversations about, you know, what we're facing right now and historically what we're facing, and just any recommendations about how to help our educators feel more comfortable and about having uncomfortable conversations, because I think that's at the root of a lot of this. That's my basic question. It's really basic, but if you can give us any guidance or recommendations about how we sit in the discomfort of all of this.
Yeah. Thank you, Chris, Dr. Reiger. It is difficult, right? And everyone has their speed, you know, in terms of how they're going to catch up or not catch up, right? So I think our role as institutions is to really provide the training, right, that our faculty need, that our staff need, and create as best as we can safe spaces, and having and I think creating those safe spaces takes time, right? Because systemic racism has created an environment where people don't feel safe, right? There are individuals who don't feel safe because the way that the system has treated them for a long time, or they've seen examples where someone has spoken out and has gotten punished, right? And then there are individuals who are afraid of saying the wrong thing and being labeled a racist. So I think it's going to take time. And again, you know, goes back to the question about how, from Dawn's question, right? How do you create trust with even families? It's going to take time, and I think as the system has to prove itself worthy of that trust, worthy of that opportunity to have these conversations. But I know some organizations, they're looking at their policy statements, right? And are they addressing equity? They're looking at practices so that they have opportunities for people to maybe anonymously and without harm to divulge concerns about racism or discrimination or bias of any kind. Sometimes there are reading circles where there's a book that people can kind of sort of break down. And again, the opportunity to use books and sort of depersonalize that conversation, right? So you have a character in the book, you have who the author, the narrator of that book, right? So you can talk through that person to kind of talk through issues. But it ultimately is going to come down to each individual and their motivation to want to engage in the conversation, their level of comfort and how they feel safe to have those conversations. But I think that doesn't mean that we don't do the work, right? As our institutions, as administrators, we still have to do the work because it's important. And we know the linkages between poor academic outcomes, the school to prison pipeline, the disparities in punishment, right? Punitive actions against kids of color. So we have to prove ourselves, and we really have to do the work, and then people will come along. It's going to be a slow process. If we could have one conversation to end racism, I would love it. But 400 years plus, and as one of my colleagues, Dr. Maria Trent, pointed out, we talk about 1619, right, being the beginning of this, but slavery occurred throughout the diaspora, right? South America, the Caribbean, Mexico, and then what we've done with indigenous lives in this country, right? So there is a long history that is going to take time to to acknowledge, because many of us still don't want to acknowledge that 400-year history plus. So it's going to take time, but we still need to do the work, even though it's hard work.
I think it's, yes, so much work. And I think we're engaged in it. And I think that we continue to come up against barriers when it's a small group of outspoken folks that are entrenched in what is. And I don't know if you have any recommendations. I think we're trying to battle it. We're trying to fight it every which way we can. But if you have any recommendations about how we kind of can overcome this, there's often a small group of outspoken folks that are just planted, and we are working so hard to try to figure out how to manage that. But any thoughts? But I see Rowan's hands up too, so I'm just interested in that concept.
Chris, I just want to, I don't have an answer, but because I am Black, I have been dealing with this conversation my entire life. And my wife, she's white, and she said to me the other day, she almost cried because her dad was trying to engage in this conversation. Her dad's white. And she saw him trying to struggle to kind of put words together and things like that. But it was moving to her because she said having mixed kids changed the way she saw the conversation that you're talking about. And she said when she looks at her family who don't have skin in the game, uncles, aunts, they don't need to be aware that there needs to be a conversation. Also, I wanted to say that I think we're in a really pivotal time because since Floyd, people have started to say, okay, maybe there's a problem. But what I see happening is that we need to be able to hold polar ideas in our heads, ideas of virtue and violence. We have to understand that this country is virtue and violence. It is not one or the other. Thomas Jefferson is not just a person that, had slaves, and he's also the person that wrote those words. And so as a society, if we can't come to terms with that someone isn't good or bad, or that we all embody grays, that I don't know, and I want the doctor to take this up, I don't know how we're going to have that conversation.
I mean, my other thought too is, right, to go back to my area, right, pediatrics. We put out a policy statement that basically said that racism impacts health. We know that homelessness impacts health and educational outcomes, right? So what is the work that you're doing to address that, right? We know that kids who are hungry, so because a child might have lower socioeconomic status, doesn't mean that that teacher doesn't help that family and doesn't provide the resources for that family. So I think I would take it back to the kids, right? How are we going to make a difference for kids? And I'm totally aware that in the educational system, right, you have an extra burden because kids come in with multiple issues, right? They come in with their family dynamics. They come in with their social emotional dynamics. They come in with their what's happening to them, bias, discrimination, racism. But your role ultimately is to have kids be successful, right, and finish school. How do you get them to the goalpost? You have to address these issues that are important and make it difficult for them to achieve. And especially you have your data. Your data shows that there are kids who are disproportionately impacted and not graduating. So that might be one way to do it, right? What's the win? Our ultimate win is to get kids to be successful, right? However you define success, to be healthy. And graduating high school is important to health. Kids who don't graduate high school, who don't have a college education, don't do well health-wise because of economy and access to healthcare. You have all these supports for kids, this is just another thing that's going to be important to help our kids be successful. So that might be, you know, why are they in education, right? To help kids, and this is why it's important, and maybe take away the issue of race and racism. They may not be ready to talk about it, but if it's important to their goals of why they became an educator, to make a difference in that child's life, then they got to take the whole child, right? And I think that's really been this discussion. It's the whole child, right? We look at home, we look at social emotional, we look at physical, we look at housing, we look at their ability to have access to clean water, food, a healthy environment, exercise, healthy foods. Those are all important. And in this issue, addressing bias in any form, whether it's racial, ethnic, sexual identity, religion, those are important. So if we want our kids to be successful, and that's part of the package. So that may be great to do that.
So we have 3 minutes left, and then I have a big question that is in the Q&A that I want to ask for this attendee who's saying something about preschool age kids. So addressing any advice on addressing parents of preschool age children who may not agree with bringing up the topic of racism.
So thank you for that question. There's some parents that are not ready yet to bring up the topic of racism or anti-racism. But what's important is, so you may not want to call it talking about having the race talk or racism talk, but it's important that we acknowledge differences. We celebrate differences. And you may not have an overt conversation about racism, but what are your actions, right? Kids learn from what we say and what we do. And more times than not, they learn more from what is not said and what is not done. And we know that there's opportunities to help our children be healthy by addressing the issue of race and racism. And for preschoolers, it's easy, you know, one of the easiest ways to do it, I'll go back to books, right? What does your bookshelf look like? You know, you want books that don't only look like your kids, not that, you just don't have all girl books, you don't have all quote unquote boy books, you don't have all just animal books, right? You want the whole spectrum. And you want to have books that have kids that are not just an afterthought, as they have to be the stars of the book as well. So you need to have books where kids of color are the stars of those books. And you normalize reading them, right? So you find a book, your child likes airplanes, right? So it can't just be the Black kid who likes airplanes. It could be a Latinx kid that likes airplanes. It could be a book that's bilingual, right? These are opportunities to start to have these conversations subtly without necessarily overtly having the conversation about racism, because you're starting to normalize the idea that we accept differences, we honor differences, and we celebrate our commonalities and our humanity.
Well, with that, I think I'm going to close. Just for the audience benefit, just so know that we are going to put up the slides and this recording of this Zoom on our Parent University website. And so we will also put resources, the article, or the policy statement from the American Pediatrics Association on our Parent U website. And what is that URL again, Nanette?
parentu.portlandschools.org.
So that is that. And with that, I just, want to thank you, Dr. Douge, for gracing us and for all of your insight. This is a great conversation. And thank you all to our panelists who you really extended the conversation into places that I'm excited about, the special places of deep conversation. So thank you so much for attending, and for the audience in the room, thank you for coming. And with that, I'll say good night.
Thank you all. Good night.